Leukemia is a type of cancer that starts in the blood and bone marrow, the place where your body makes new blood cells. Unlike solid tumors that form in the organs, leukemia is a cancer of the cells that are supposed to protect you, white blood cells. Normally, your bone marrow makes controllable amounts of red blood cells, white blood cells, and platelets. In leukemia, something goes wrong in the DNA of developing white blood cells. Instead of maturing normally, this cell becomes cancerous and starts multiplying out of control. These cancerous white blood cells don't work the way they should. They crowd the bone marrow, leaving less room for healthy blood cells to form. That's why people with leukemia often become anemic, bruise easily, get frequent infections, and feel weak or tired. Their blood system is being taken over from the inside. There are several types of leukemia, but they fall into four major categories based on how fast they grow and what cells they affect. Acute leukemias, like ALL and AML, progress quickly. The cancerous cells are very immature, dividing rapidly and overwhelming the bone marrow. Chronic leukemias, like CLL or CML, develop more slowly. The abnormal cells are more mature, but still dysfunctional. People can sometimes go years before the symptoms become obvious. What triggers leukemia? There's no single cause. Genetic mutations, radiation exposure, certain chemicals, smoking, or sometimes inherited conditions can increase risk. But many cases happen with no clear reason. The core problem is a mutation that gives one blood cell a survival advantage, allowing it to multiply unchecked. Diagnosis usually starts with a blood test showing abnormal white cell counts. A bone marrow biopsy confirms the type of leukemia and how advanced it is. Doctors also analyze genetic markers and study the cancer cells. These help determine treatment and prognosis. Treatment depends on the type. Acute leukemias require urgent chemotherapy to wipe out cancerous cells. Some cases may need targeted therapy, immunotherapy, or a bone marrow transplant to rebuild a healthy blood-forming system. Leukemia doesn't form a tumor you can see. It's a cancer that spreads through the bloodstream, affecting every organ by disrupting the blood itself. Understanding how it works shows early sign detection and treatment are critical, and why modern therapies have dramatic